Today is my first day of radiotherapy. I'm going to see Dr. Lee before starting the treatment. I feel pretty excited. Hi, Dr. Lee. Please come.
Well, I've got your plan ready. So I'm going to show you what we are going to do today. This is your plan. What we've done for you. If you just look at this plan itself.
Angela has stage 3 nasopharyngeal cancer, or NPC, the most common cancer in the head and neck region.
All these will get much lower doses than
60% of head and neck cancers occur in the nasopharynx, that is behind the nose, close to the brainstem. But other cancers of the head and neck may arise in the nasal cavity. The oral cavity, which includes the lips and tongue, the salivary glands, the larynx or voice box, and pharynx, a passage that leads from behind the nose and mouth to the larynx. There are several treatment options, but because these tumors are located near our sensory organs, deciding on the right option is key.
A lot of patients have to really sometimes see the doctors and go to some depth with them and say, okay, how is this journey going to be? Because it's going to be a while and it's going to be long. And I think a lot of patients at that point when they make the decision don't realize how long it's going to be. Oftentimes, and especially head and neck cancer patients where the function and the form is a problem.
For Angela, combined chemotherapy and radiation is the best choice, since surgery near the brainstem is not a viable option. Barely 6 months after giving birth to a girl, she is now braced to fight the disease. With just 2 hours before her first radiotherapy session, is she prepared for what the high-energy X-rays will do to her?
I'm kind of worried about how to cope with the side effects after reading all the online information about the radiation treatments for NPC patients, like taste change. Like when I'm drinking Milo right now, it's sweet, so I may not be able to taste sweet, or it may taste sour drinking Milo. So kind of weird, kind of strange to me. And then the ulcers in the mouth or sometimes in the throat that may make me difficult to swallow. So how am I going to cope with it?
Minutes before the treatment, Angela gets the doctor's assurance.
We're seeing that the darker doses are actually in the back of the nose, and this is where the cancer is. So we concentrate that radiation here. These are the salivary glands. Okay. So we want to avoid the radiation into the area so that you don't end up with permanent dryness. So we can do that. We can achieve in this plan where you get lower doses there.
A custom-made mask is used to hold Angela's head in place during each session. Intensity-modulated radiation therapy allows more precise killing of cancer cells than conventional radiotherapy. This is made possible with the addition of image guidance function in the radiation machine.
Angela is in the room now on the tomotherapy machine. We are performing a scan on her now. This CT scan will capture the position of her nasopharynx. When we do that, we are actually aligning the normal tissues in the right place, the cancer in the right place as well. So in this way, we are always certain that the high dose, which is targeted at the cancer cells, will be directed accurately into the cancer itself. In this way, we will never miss the cancer cells. At the same time, we will not end up with high doses into its neighboring normal tissues.
Do I feel anything? Well, actually I didn't feel anything. It's supposed to be like that, just like a normal CT scan or MRI, and I don't feel any sensations at all. So I look forward to the next few sessions to be able to see the CT scan images to make a comparison.
To 32-year-old Angela, cancer is the fourth milestone in the last 4 years. She got married in 2004 and 2 years later moved to Singapore to embark on a new teaching career in a local university. In October 2007, she became a mother, and now it's the 4th week into her radiation treatment. This is the time when most of the side effects are kicking in. Concerned for her daughter, Angela's mother flew in from Hong Kong to see her through what she calls the darkest period. With a parched mouth and throat, this has been her diet for the past 2 weeks.
中國人呢就信一個命咯，有時你嚟到嘅你要接受，所以佢有好嘅醫生醫你去，咁你我亦都好放心。捱過就冇事㗎啦，唔怕㗎。我唔怕嘅。我叫佢乜都唔需要諗咯，醫好自己個病，你先至可以望到個小朋友咯，長大咯，俾啲勇氣自己去過咗個最難過嘅時間。
My daughter, ballerina, she just turns 8 months, but she's the biggest cheerleader so far throughout the treatment process, and she's the best medicine for me to cope with all the side effects. And even right now, I don't taste any food, or any food will turn very salty, but when I look at her, and all food is like just adding some sweetness inside. So this is why she's so important in my life right now, that keep me just to hang in there and try to get through everything and to get a full recovery.
Nasopharyngeal cancer is one of the most curable head and neck cancers. Although it's very common in this part of the world, we are blessed with the fact that we can combine chemotherapy and radiation and offer many patients a very good chance of cure. In patients, despite having locally advanced disease, up to 70% of these patients can still be cured of their nasopharyngeal cancer.
But that was the last time we heard Angela speak. Towards the end of her radiotherapy, she lost her voice due to severe pain caused by ulcers in her mouth and throat. These are her SMSs to the production team. Angela is looking forward to the end of her present suffering. In 2004, Madam Tan Siu Eng was diagnosed with a common cancer found in the head and neck, laryngeal cancer or cancer of the voice box. In an early stage cancer, radiation is the main treatment. Madam Tan had advanced laryngeal cancer with spread to the lymph nodes in her neck, and the doctors urged her to go for a laryngectomy, a surgery to remove the voice box.
When Madam Tan came to see me, what she was very clear about was that she was not going to undergo surgery whereby she would end up without a voice. Somehow to her, it was far more important to have that quality of life rather than to worry about how long she was going to live. In other words, she was willing to sacrifice her life in exchange for quality.
This worried her family, who banded together in search for an alternative. Indeed, there are other options available. Mr. Ong En Tien was diagnosed with advanced cancer of the voice box 12 years ago. The doctor advised him to remove his voice box along with the tumor. He chose to undergo surgery to save his life.
A total removal of the larynx have always been the state-of-the-art operation, have always been the main standard of care. However, in our Asian context, a lot of patients really don't want to go for surgery because not being able to speak is a big problem socially. The patients are left with having to continue their lives with a hole in the neck for breathing and unable to speak. So right now they can speak through three ways if they have no voice box. One is to use what we call esophageal speech, where they use air from the stomach and they push it through the swallowing passage, and using that as a vibrating segment, they produce speech. And some patients really do that very well. The alternative option actually is to use what we call electrolarynx, which is to put a machine that has a vibrator, and when they move their muscles, the vibrator changes its tone and they're able to articulate from that. But it's a very mechanical, as you would expect. And then the third one actually is to put a hole through the front of the windpipe to the back of the gutlet. And when they actually close their hole, they breathe out, the air goes through into the gutlet and they can speak. And that's what we call a tracheoesophageal fistula or connection.
I felt very uncomfortable. I swallow air to the stomach. Very uncomfortable. But later, now it's okay. Normal.
So life is normal.
It took 4 months for Mr. Ong to learn esophageal speech. At the New Voice Club, he's been helping others cope with the change for more than 10 years now. Another member, Mr. Tang Jin, speaks by blocking the hole in his neck. Other than a new way of speech, their sense of smell is also affected. After the surgery, air enters and exits the body through the hole in the neck called stoma. Whereas in normal breathing, air enters the body from the nose and goes into the lungs, it is also exhaled through the nose.
So if there was a large pungent smell, yes, they will still pick it up because the amount of air going in is enough to stimulate the smell receptors. But they are not going to really appreciate coffee like you and I do, or durian like you and I do. So having a total laryngectomy is not exactly the best thing in the world, but if it's needed to be done in order to save the life, I think it is a reasonably good operation that can keep a life for a long time.
Mr. Gabriel used to smoke up to 120 cigarettes a day. When diagnosed with advanced laryngeal cancer 6 years ago, he thought it was payback time. There was not much time left for any other forms of treatment except surgery. And he was prepared never to hear himself again.
There are many types of surgeries that have been devised over the years. And with regards to surgery for the larynx in particular, is the most probably the challenging one, in trying to preserve voice function, at the same time preserving breathing ability and swallowing, and trying to keep all three functions abreast for the patients. And so when we are able to do that, we are always trying to not remove the entire larynx, That's why there's this whole school of thought of partial laryngectomies or conservational laryngeal surgery.
Conventionally, a total laryngectomy removes the entire voice box. With advancement in research and surgical procedures, up to 90% of the voice box can be removed whilst preserving the patient's voice function. But along with the removal of some lymph tissues, his right cheek and shoulder are permanently affected. With 10% of his vocal cords left, Mr. Gabriel is able to retain his voice and also sense of smell, what Mr. Ong and Mr. Tang had to do without.
Yeah, they couldn't reach, and it is worth it. I use the word, it is worth it. It wasn't worth, it is still worth it.
"79-year-old Madam Tan Siu Eng is chef de cuisine of the family. For most years of her life, she lived for her 5 children and 7 grandchildren. 4 years ago, when laryngeal cancer threatened to kill her, she almost gave in. Seeing her late husband suffer a stroke, Madam Tan decided that life was not worth living if one could no longer talk. The other option that her family found is combined chemotherapy and radiation treatment.
In recent years, there's increasing data to suggest that the combination of chemotherapy and radiotherapy may offer the patient an added advantage in terms of better local control as well as improving the survival of these patients. Unfortunately, there will be about 30 to 40% of patients where the disease will recur, and when it recurs, then obviously you have to consider some form of a salvage procedure, like for example a laryngectomy.
Ruling out surgery, Madam Tan held on to the 60% chance of recovery and went for chemotherapy, first to downsize the tumor. Later, radiotherapy with chemotherapy was planned to eradicate the disease.
When she went for, I think 2 months chemo, and I find her like, she's like a normal people. She eat normally, she live normally, everything was normal. So we feel that, oh, there is hope.
However, with the addition of radiation treatment, the side effects set in.
We know that radiation alone is often enough to eradicate the cancer cells. But what has been demonstrated through research is that when you add on chemotherapy, the chemotherapy not only does it kill the cancer cells by itself, but it also serves as a radiosensitizer. What do I mean by that? the chemotherapy makes the cancer cell more susceptible to the killing by the radiation treatment, and thereby ending up with better local control.
拜就暑假，去拜，哎呀，煮了人食就好啦。我袂使食不要紧啦，但你爱食就好了吼。莫咁样讲，靠我一个食，逐个人爱食什么，我就莫讲，我袂使食你人买啊，不要煮，我教你人煮。
Madam Tan's determination and self-discipline go some way to explain her recovery. Now, her 4th year in remission, she's happy to live with a dry mouth and a somewhat imprecise taste bud. A small price to pay in exchange for a voice. Angela regained her voice 2 weeks after treatment. It's now 6 weeks post-treatment, and she goes for a final nasoscope to see the results of her combined chemo-radiation therapy.
Okay, I'm going to take this out. There is no tumor inside. The back of the nose is superb. I'm actually very happy. Okay, alright?
I would say that seeking a second opinion from a medical expert is very important, especially if you have cancer. And always, if you have doubt in mind, then don't wait.
With better medicine and newer technology to fight cancer, doctors agree that there is no lack of treatment choices. What is crucial for patients is an understanding of what each option entails and to approach it with optimism.